I can't believe we're at the last session. How did that happen? One thing I would like to say before we have this wonderful conversation while Nakela is coming up to the stage, and before I introduce her, is that I think a common thread that we're hearing throughout today, whether we're using strong language or diplomatic language, is that change has to happen, and it is happening. And so I'm really, really excited that we had this conversation at this point in time. It's my distinct pleasure to welcome as our final conversation, Dr. Nakela Cook, who many of you know is the Executive Director for the Patient-Centered Outcomes Research Institute. A lot of us use the before and after in terms of COVID. I will say that I was a patient advocate in the time before PCORI existed, and was one of those obnoxious upstart advocates in the mental health community asking the question, why do we not have patients at the table in conducting comparative effectiveness research? So I think that PCORI is an example of how maybe hopefully not 20 years hence, but in the future, we can envision a conversation in which patients are very much at the center of this conversation. So happy to have you here with us today, Nakela. Nakela is both a cardiologist and a health services researcher by training. So we know that she understands at a cellular level both the complexities of research as well as what it's for, which is about practical application to the clinical practice of medicine. She embodies leadership and accountability in helping PCORI rethink its strategic plan with a focus on patient inclusion, on diversity and equity, and how we transform research in those dimensions. So I'm really pleased to welcome Nakela to the podium for a few moments of remarks, and then we're going to have a chat to close this out. Thank you, Nakela.
Thank you so much, Jennifer, for that kind introduction. And it's just a pleasure to be here and to see all of you. I'm glad to be here today. And, PCORI and IVI actually share a lot of interest, and we have some familiar faces in the room. And so it's wonderful to see all of you. And, I was reflecting on the fact that Ashley Valentine was actually a keynote speaker at our annual meeting this past year and shared with us, I think, in a very vivid way, the importance of understanding the lived experience. And so I'm just pleased to be here. We also had the opportunity to participate in the Equity and Health Technology Assessment Roundtable and learned quite a bit there. And I think there is this great dialogue and exchange that was exhibited there, is exhibited here, and really thinking about how we push the boundaries on the activities in the health equity space. And so many of you are familiar with PCORI, but some of you may not be. And we're an independent nonprofit research organization that really focuses on seeking to empower patients as well as others with actionable information to inform the healthcare decisions that they may face on a regular basis. And we do this through funding comparative clinical effectiveness research, or CER as we'll refer to, in probably much of the dialogue today. But that CER really engages patients and other stakeholders in the healthcare community to help inform and seek what's most important to those individuals as well as those communities for areas of focus, as well as how we conduct funded research. So through December of last year, we funded about $4 billion in research projects at PCORI, over 2,400 projects. And so we're really at this point in the organization related to our research efforts, our engagement efforts, dissemination and implementation efforts, that we could take this reflection point and really think about where we go in the future. And Jennifer alluded to that because we went through a recent strategic planning effort. And one of the things that emerged in that effort is that health equity is just so central to our mission. Achieving health equity is one of our 5 national priorities for health, but it really undergirds almost everything that we do. And I kind of think about the comparative clinical effectiveness research that we fund as inherently equity-minded. It really involves a diverse array of patients and a lot of other stakeholders, and thinking about the research process and providing answers to the questions that are most important to them. While we don't necessarily fund health technology assessment, which is really the topic of this meeting, But we've clearly heard from you and from many others about how the research that we fund actually is really critical in terms of the benefits and harms that are assessed in the types of comparative clinical effectiveness research that we fund that funnels into the work of health technology assessors. I thought I'd just briefly mention a couple of things related to health equity and economic outcomes. Really, I think two critical foci of this meeting. We, a couple of years ago, put forward a public commitment to diversity, equity, and inclusion because we think it's so critical to the achievement of our mission. And what we said is that we're committed to being equitable and engaging diverse stakeholders, promoting diverse and inclusive convenings, as well as a diverse pool of applicants, awardees, and participants in PCORI-funded research. And we complemented this statement with a diversity, equity, and inclusion strategy, which really has three main goals: to learn, to expand, and to engage. And each of them really correspond to PCORI as an organization, as a funder, and as a partner. So our goal to learn really seeks to foster a learning and action-oriented culture at PCORI and with all of PCORI's community. And our goal to expand refers to doing research differently and refers to our national priority for health on health equity, as well as our health equity portfolio. And our goal to engage really speaks to broadening our reach through capacity building activities, applicant and participant diversity, and enhancing and deepening our strategic partnerships to promote health equity. So I also just wanted to mention a couple of brief initiatives that illustrate our approach to diversity, equity, and inclusion and achieving health equity and may serve as resources for those of you in the room. One is the set of what we call guiding principles that we've developed for stakeholder engagement that place equity, diversity, and inclusion at the center of research partnerships. And these principles include inclusion, equitable partnerships, trust and trustworthiness, and accountability and actionability. And they ensure that DEI as a goal of our partnerships is there from the beginning. And I heard that in some of the emphasis just now, and that it really provides some useful guidance for people who are involved in health research. We've also issued a new funding opportunity that we also see as really exhibiting the principles that are articulated in that strategy. And it's called the Partner Funding Announcement. And it's designed to help communities build research capacity by positioning community organizations as equal and full partners with the research organizations that are approaching the challenge of maternal health. And this funding opportunity focuses on multi-component interventions. So not just the interventions that are in the clinical dimension, but all of those that relate to social determinants of health as well. And we think that type of full partnership with communities and research organizations is critical to really achieving those goals. And finally, we developed some supplemental funding related to health equity, where current eligible awardees are able to increase the diversity and representativeness of their study populations in existing funded CER projects. So where we found that there were gaps, we're really funding that opportunity for these awardees to really pursue that representativeness in studies. And I want to turn to economic impacts for just a moment, because as you know, part of our mandate is that PCORI-funded investigators should, as appropriate, consider the full range of outcomes in their studies. And this includes cost and economic burdens. And they're clearly important factors for patients when considering their health in terms of thinking about the cost and economic burden of different healthcare options. And the first step of this work was really to try to establish patient and stakeholder-driven principles around the collection of the full range of outcomes. And we thought it very important as a first principle to make sure that the outcomes are important to patients and their caregivers, and that that's a critical component to how we'll look at this type of work. We also have a principle around these outcomes being important to other stakeholders, especially when the outcomes have near-term or longer-term impact on patients. And that the collection of data on potential burden and economic impacts of an intervention has to be really appropriate to the clinical studies that are being undertaken. And we also want to support certain types of economic analyses that are a part of the clinical research to enhance the relevance and value to patients. We've also heard in this work a real interest from patients and stakeholders in helping to clarify the diverse perspectives around what constitutes patient-centered value in health and healthcare. And so to that end, we've actually recently published a landscape review to gather perspectives from stakeholders on what value really means. And we convened patients and other stakeholders to share their perspectives on what may be the important components of patient-centered value. And the draft inventory that we've published on our website has 48 different components identified to inform the continuing conversation around patient-centered value. And I'd like to take a moment to thank IVI and others in their room for candid feedback on those perspectives. And we hope this report and inventory actually will shed some light on not just the diverse perspectives, but also sometimes divergent perspectives amongst patients and families and the broader healthcare community on what constitutes patient-centered value. So now we're really turning our focus to accelerating and amplifying our work around the collection of this full range of outcomes data. And it's really an initiative that we're framing as patient-centered economic outcomes. And these outcomes are more than just the cost of care. It's really about out-of-pocket cost and burdens like time off from work or childcare and transportation. And our goal is to build a taxonomy of patient-centered economic outcomes that ultimately can be incorporated iteratively in our funding opportunities and the research that we fund at PCORI to not only help shape the research, but also provide more of an organized and systematic reporting of this type of data at the close of a project and across projects, really. But to accomplish this work, we really are engaging continually with our community, including patients and families and caregivers and advocates and others. And as with health equity, we also have supplemental funding on these patient-centered economic outcomes for existing comparative effectiveness research projects that will help us understand the cost and other economic burdens to patients, allow us to iterate on what we're learning in order to really incorporate it fully in projects moving forward. I hope this really brief introduction just gives you a sense of some of the things that we're doing at PCORI related to health equity and patient-centered economic outcomes and economic impacts of healthcare. And I want to turn it to some time for discussion. It's nice to be in this bridge between the end of today and moving into tomorrow, when I know you'll be talking about more of the economic outcomes tomorrow. So thank you so much, and I look forward to the discussion.
Okay. Oh, there we are. Thank you very much for being here with us. So you talked, first of all, you mentioned some resources. I, at the beginning of the day, pointed out that we have a QR code where people can access the different resources. The one exception is all the things she just pointed to, but I know a colleague was posting the links in the chat. And as a follow-on to this meeting, everybody who was registered will get get those links pushed to you. So if you go and use the QR code and you don't see any of the things Nakela just mentioned, they will come to you. So, so you framed out really nicely kind of what's the next horizon for PCORI and what you're, the direction that you're thinking. And happily, it's many of the things that we've been talking about today. So what signals are you monitoring? Like, what's going to tell you that we're moving in the right direction? Let's talk about equity first. I want to talk about both of these issue areas that you raised, but thinking about equity, what signals are you watching at PCORI that will tell you that the research enterprise is kind of moving in the right direction?
Well, I really like that term signals because we're really looking for the types of signals that'll help us with understanding of even metrics that we can use. And one of the things that, I think may be a little bit different in the way that we're thinking about things is that we really are relying on looking for measures of engagement in research. How effective is it? Is it bringing those that have been historically marginalized or underrepresented into the research fold? And we're also thinking about things such as trust. And are we building the relationships and the trust in the research enterprise that actually helps us with moving research results even to clinical practice or next step outcomes? And some of those types of measures aren't really quantifiable in, kind of standardized, repeatable measures. And so we've recently put together a science of engagement initiative that's really focused on understanding with a degree of rigor what works in engagement and what doesn't work in engagement, and whether we're really reaching the communities we're intending to reach, and is the information relevant and important to them? And eventually also the development of measures that will help us to measure this in our studies moving forward. And I think it's going to give us a lot of insights from these projects that we're funding to provide even an inventory of these types of metrics and measures that may come from this work that can be used by others. So we're really excited to look for signals like that in terms of how we may be reaching the communities that we want to reach and pursuing the outcomes that are important to them. And maybe the other thing I'll mention is that ultimately, I think a lot of what's going to be reflected in terms of our goals for health equity is about who's involved in the research process. Are we getting those involved that are setting the priorities that we intended to reach? What's the makeup of the research participants? What's the makeup of those investigators that are involved in other community and stakeholder organizations that are involved? And is the information that's coming out actually trustworthy and important to the communities that we were intending to engage? And so those are the kinds of things that I think will be our signals as we move forward.
So one of the, this is kind of a bridge to tomorrow, where we're going to be talking a little bit about IVI's initiative to put some edges around the economic impacts and begin to create that taxonomy. So just, I don't want to give away tomorrow, so please tune in and for the public webinar tomorrow. But as you think forward to, you mentioned 48 items in that inventory. Any priorities that are starting among your colleagues that you're starting to talk about? This is where we really need to lean into funding these certain priorities in terms of the economic impacts that are being measured.
Yeah, so as I mentioned, we at PCORI really focus on the collection of data around the types of CER projects that are being funded. And so we don't directly fund projects around economic impacts, but our thinking about our outcomes in our study has certainly evolved. Evolved from the kind of traditional clinical outcomes that have been predominantly of interest in our work to date to much more about the breadth of the full range of outcomes that are important. And so I think that we'll be learning through a lot of this data collection that we talked about with the supplements that are currently underway that'll help us see the signals of what's important in the collection of this type of data. But we also recognize there's no resource or national data set that's going to provide us the type of economic outcomes that we're looking to collect, those outcomes that are really important to patients. And so we're fortunate that we recently appointed new members to our methodology, and several of them have this type of expertise. And so we want to take that data that comes from these projects and start to think about, where do we need standardized data collection in this space for economic outcomes? Where is it that it needs to be more tailored? And how can we provide guidance across not just the work that we fund, but that may be important for this community and other communities related to these opportunities? So I think that's something that's really to come in terms of the priorities we're seeing emerge. Related to those 48 items of or different components and perspectives of patient-centered value, I think one of the important issues related to that is something that I mentioned, is that there are some commonalities and some divergent perspectives there. And so we really want to make that a resource that all of our research communities, our research applicants, et cetera, can leverage when they're trying to put together studies related to a specific condition or health behavior or other things, so that they can recognize the stakeholder community's perspectives on all of these different components of value and try to engage that when they're putting together their projects.
Great. Before we turn to some audience participation, last week, PCORI announced a major new initiative with clinician communities about translation and implementation. Very exciting, lots of big name, provider communities. And in the last panel, Greg talked about, it wasn't so much about payers as it was look to smaller health systems. So in that vein, like knowing that that's kind of a focus for that initiative, how have you built in some of the equity considerations and this notion of economic impacts? Have you built that into this new initiative?
Well, interestingly, the equity considerations and the economic outcomes are pervasive across everything that we're doing at PCORI. And so it is incorporated in the way in which we're now designing our funding announcements, the way in which we're thinking about review. We're incentivizing our applicant community to really address these issues by explicitly asking for how projects are going to meet goals like equity or economic outcomes. And so we're really excited about this kind of new phase for PCORI. And the initiative that you're referring to, Jennifer, is the Health Systems Implementation Initiative, where we have identified health systems that are really going to work with PCORI and thinking about how to implement PCORI-funded research results in their health systems and what is it going to take for that to happen. And there are a lot of leaders and a lot of health systems across the country that are participating in this initiative, and they span, large academic-based and other types of systems to smaller systems that may be more safety net related, or even smaller clinics within systems and things of that nature. So really a span of representation of the health systems in the country. And part of what we're working on related to equity as well as related to economic outcomes is that these are the systems that know their communities. They know those that they're trying to move in terms of health outcomes. And we've asked them to really lean in and provide us with what does it take for capacity building to reach those communities. We have capacity building awards as the next step. And then moving toward the economic outcomes, it's really about what does it take to implement in order to make it an effective, efficient, and affordable implementation within the systems and for the patients involved. And so we anticipate we may see things that are infrastructure projects for these health systems that actually help them with the implementation of these types of activities. So it's really exciting. We're looking forward to learning. We have a learning network as part of this. And so there will be a lot of outcomes from the learnings across the health systems as well as what we can share more broadly.
Thank you for sharing that. Let's see if we have any questions from the audience. Melanie, do we have any online? No, not yet. Tom.
Sorry. Hi, Dr. Cook. You mentioned that PCORI can now, and I think the implication was you can do it now in a way that PCORI couldn't until maybe the last reauthorization of the organization, that you can support work that is on economic impacts and so on, or comparative effectiveness research that can inform health technology assessment or thinking about HTA, but you can't support HTA directly. I wonder, how far you can comment on how far PCORI can take this. For example, patient preference trade-offs. And I apologize if PCORI is supporting this in a way that I'm unaware of, but how far might PCORI go in supporting patient groups that want to do projects on trade-offs, on patient utility, that kind of thing?
So our primary focus is still around the comparative clinical effectiveness research related to the outcomes, and usually health outcomes that are most important to those communities and patients that are engaged. And so that still becomes the primary focus. And what really has changed is our ability to collect additional data around the interventions and the outcomes, et cetera, that are important to patients and important to other stakeholders alongside the conduct of those studies. And so that's what we're really excited about, is that we can support that data collection, but that information is then relevant, we think, to lots of stakeholders, including health technology assessors, et cetera, who may want to take on additional analyses with the outcome from that work.
Anybody else? Okay, I can come up with one.
Okay.
Somebody said this morning, it may have been me, I don't remember anymore, but somebody said this morning that we are the room of the converted. One of the things I think IVI really prides itself in holding these method summits is to force ourselves out of the echo chamber and to broaden our conversation. So how do we, and how is PCORI part of the ecology of evangelizing? How do we bring more disparate voices to the table? Any thoughts about that?
Well, I think it's a great thought, and perhaps even some of the activity we've done and engagement is not because we always anticipate a community or group that we're engaging with is going to propose a study on comparative effectiveness research, but we recognize they're part of a larger ecosystem. And so we need to understand those perspectives. We need to be thinking about, how might the interaction itself have repercussions and kind of ripple effects where others may become engaged in work related to health that we hadn't previously anticipated. And so some of that is around partnerships and working through those partnerships. And, I mentioned that our new strategic plan has this national priority focus on achieving health equity. We can't do that in our traditional partnerships. And so we find ourselves talking with entities that we hadn't traditionally talked to in health, that thinking about those determinants of health that are far beyond the clinic and, education and housing and other types of issues that now we need to talk about the issues in health with groups that particularly haven't had health as their primary focus or even CER as their primary focus. And I think that expands that coalition, so to speak, that you're describing. The fact that we've broadened our views, I think, is part of how we start to help engage even beyond those that are in the room.
Beautiful. Lead by example. That's the lesson there. Okay, last question. And you're the last speaker of this day. So what is your challenge to IVI? What is it that we can be doing in the future that helps support all this wonderful work that's happening at PCORI?
Well, I alluded to the fact that we've certainly benefited from a lot of the work that you've already done. And so we certainly look to understanding the needs that technology assessors may have, or the perspectives that those involved in terms of understanding patient perspectives, families, communities, et cetera, perspectives that are important in the type of work really that's central to IVI's mission, because then we as a funder of research start to understand what may be needed to really meet the needs and the evidence needs for organizations that are really working in this space. And so I wanted to first thank you for the work you've already done, because I think it's been incredibly informative to us. I was so pleased to see the resonance in some of the reports with the way in which PCORI is thinking about some things. And so, seeing that reflection of things like the engagement, the trust, the importance of communities that have been historically marginalized, the outcomes that are going to be important to them, challenges us too to make sure that we remain on the ball in terms of the evidence generation that helps inform what you're hearing from your stakeholders and participants. And maybe lastly, I'll say, keep us part of the conversation, because I think that's the other component. And, while we may be engaging in certain circles, we learn when we hear certain things come through in other scenarios and perspectives. I learned from the panel today. And I'm going to learn from every interaction probably that you have here in terms of looking at the reports and the outcomes. And so that's what we really benefit from.
Well, that is the best outcome I could possibly achieve for today's Method Summit. So thank you, Nakela, for spending time with us and sharing your wisdom and forward thinking. Please join me in thanking Nakela for being with us. And before I hand off to Elisa and Jason, because they get the last word today, I can't resist in saying, here's what I hope you leave with today. So as you leave today, your homework is the following. Share what you learned. Share the doggone report, because we put a lot of work into it. So share it widely, share it with your colleagues, share it with people you meet at your next conversation.